Welcome to the Health Angel. Did you know that liver disease is the 12th leading cause of death in the United States, claiming more than 31,000 lives each year? A startling statistic, isn't it? But it's a harsh reality we face today, underscoring the importance of maintaining liver health. Our liver, a powerhouse organ, quietly goes about its business of detoxifying our blood, producing the bile needed to digest fat, breaking down hormones and storing essential vitamins, minerals, and iron. When this silent hero of our body fails, the consequences can be severe, even fatal. Liver failure, often a culmination of years of liver disease, can creep up unnoticed. It's a slow process, the symptoms subtle and often mistaken for other ailments. However, by understanding the signs and symptoms of liver failure, we can intervene early, potentially halting or even reversing the progression of liver disease. So what are the telltale signs of liver failure? Before we proceed, please subscribe if you haven't so you will be notified of our new videos. Let's go. In the following scenes, we'll discuss 10 signs of liver failure using real-life case studies to illustrate each one. We'll plunge into how these symptoms present, what they mean for the body, and how medical intervention can help. We will also outline how you can prevent liver damage. One of the earliest and most common signs of liver failure is abdominal pain and swelling. Let's take the case of John, a 40-year-old man with a history of excessive alcohol consumption. John began to notice a persistent pain in his upper right abdomen, accompanied by an unusual swelling. This discomfort is often the liver's distress signal. Now you might be wondering, why does this happen? Well, when the liver struggles to perform its functions due to damage, it enlarges, causing a condition known as hepatomegaly. This enlargement pushes against other organs and tissues, leading to the abdominal pain and swelling experienced by people like John. Additionally, fluid may accumulate in the abdomen, a condition known as ascites, as the liver fails to produce enough proteins to hold fluid in the blood vessels. This further contributes to abdominal swelling. If you experience persistent abdominal pain and swelling, it's crucial to consult a healthcare professional immediately. Another common sign of liver failure is jaundice, a condition that causes yellowing of the skin and eyes. Let's consider the case of John Doe, a 50-year-old man who noticed a yellow tinge in his eyes and skin. John's experience isn't uncommon. Jaundice occurs when there's an accumulation of a substance called bilirubin in the blood. The liver's job is to filter out bilirubin, but when the liver is failing, it can't perform this function as efficiently, leading to the buildup of bilirubin. This excess bilirubin then starts to leak out into surrounding tissues, resulting in the characteristic yellow hue of jaundice. It's important to note that while jaundice can occur due to several reasons, its presence in combination with other symptoms could indicate a serious liver condition. Remember, any sign of jaundice should be taken seriously and warrants medical attention. Loss of appetite and unexplained weight loss can also be signs of liver failure. Let's delve into the case of John Doe, a 50-year-old male who noticed a significant loss of appetite coupled with a drastic weight loss over a short period of time. John's story is not uncommon among liver failure patients. The liver plays a crucial role in digestion and the regulation of nutrients in the body. When it's not functioning properly, it can cause a decrease in appetite. This is mainly because the liver's ability to metabolize fats and proteins becomes compromised, leading to feelings of fullness or discomfort after eating. The weight loss typically follows as the body starts burning stored fat and muscle for energy. If you're experiencing a loss of appetite and unexplained weight loss, don't ignore these signs. Seek medical advice. Your body could be signaling something serious like liver failure. Chronic fatigue and weakness can also be symptoms of liver failure. Let's consider the story of John. He's a guy in his mid-40s who used to be the life of the party, but lately he's been feeling unusually tired and weak, even after a good night's sleep. This isn't just about feeling a little drowsy after lunch, it's a persistent, ongoing feeling of exhaustion that's affecting his daily life. So, why does liver failure cause fatigue and weakness? Well, the liver plays a crucial role in our body's energy production. It processes nutrients from our food, turning them into energy that our cells can use. But when the liver is failing, it can't perform this function as well, leading to a decrease in energy levels and a feeling of constant fatigue and weakness. Remember, this isn't about one-off instances of feeling tired. We all have those days, but constant fatigue and weakness, especially if accompanied by other symptoms, should prompt a visit to a healthcare professional. Nausea and vomiting are also common symptoms of liver failure. Now, a real-life scenario. Imagine a patient, let's call him John. John started experiencing a persistent feeling of queasiness and bouts of vomiting over a few weeks. His family chalked it up to a stomach bug, but these symptoms are often more than just a passing illness. You see, when your liver is failing, it can't properly process toxins. The buildup of toxins in the bloodstream causes nausea and vomiting. If you or someone else is experiencing persistent nausea and vomiting, it's not something to brush under the carpet. Persistent nausea and vomiting are not normal and should be evaluated by a healthcare professional. Itchy skin can be another sign of liver failure. Let's take a hypothetical case, for example. Let's call her Alex. Alex, a middle-aged woman, noticed that she had been scratching her skin more than usual. It started subtly at first, but gradually became an incessant itch that kept her awake at night. Now you might wonder, how is this linked to liver failure? Well, when the liver is failing, it struggles to filter out toxins and bile salts from the bloodstream. These can then accumulate and get under the skin, causing the nerves to fire off, resulting in an itch. In Alex's case, her itchy skin was accompanied by other symptoms of liver failure like fatigue, loss of appetite, and abdominal pain. However, itchy skin isn't always indicative of liver failure. It can be a symptom of various other conditions too, which is why it's crucial to consult a healthcare professional. Dark urine can also be a sign of liver failure. Let's take a look at a case study. John, a 45-year-old man, noticed his urine had turned a dark amber color, much darker than the usual pale straw hue. Concerned, he sought medical advice. The liver, you see, produces a substance called bilirubin, which is usually excreted in the stool. However, when the liver is failing, it can't process the bilirubin properly. Instead, it ends up in the bloodstream and eventually in the urine, causing it to darken. In John's case, this change in urine color was an early warning sign. It led to a diagnosis of liver disease, which was able to be managed thanks to early detection. Remember, our bodies often signal when something is off. Dark urine might be a sign of dehydration, but it could also signify something more serious. Dark urine is not normal and should be evaluated by a healthcare professional. Don't ignore these signs. Your health is your wealth. Pale stool is another symptom of liver failure. Now, let's consider a case study to understand this symptom better. Imagine a person named Alex. Alex, who is generally healthy, begins to notice a change in the color of his stool. It has turned from its normal brown hue to a lighter, clay-colored or even white shade. This change is caused by a lack of bile. Bile is a dark green to brownish fluid produced by the liver that aids in the digestion of lipids in the small intestine. In liver failure, the liver's ability to produce bile is compromised, leading to a lack of pigmentation in the stool. Just like how bile plays a role in giving a brown color to the stool, its absence or reduced production can result in pale or clay-colored stool. This is a clear sign that the liver is not functioning properly. If you notice changes in your stool color, it's essential to seek medical advice. Liver failure patients often bleed and bruise easily. Consider an account of a 35-year-old woman who found herself waking up with unexplained bruises and her gums bled while brushing her teeth. After a series of tests, she was diagnosed with liver failure. But why does this happen? The liver plays a critical role in the clotting of blood. It produces proteins called clotting factors, which are required for blood clotting. The liver also produces thrombopoietin, a protein needed in the production of platelets, which are cells that help in blood clotting. When the liver is failing, it can't produce enough of these proteins. This results in a higher risk of bleeding and bruising, even from minor injuries. If you're bruising or bleeding easily, don't ignore this sign. Consult a healthcare professional. Your liver might be sending you a warning that requires immediate attention. The final sign of liver failure we'll discuss is confusion and sleepiness. Picture this: a gentleman in his late 50s named John, who was once active and sharp, now spends most of his days in a daze, often struggling to remember simple things. It's not just age catching up to him. John has what is called hepatic encephalopathy. This condition occurs when the liver can't adequately remove toxins from the blood. These toxins can then build up and cross the blood-brain barrier, leading to neurological symptoms like confusion and excessive sleepiness. In John's case, his family noticed his uncharacteristic forgetfulness and prolonged periods of sleep, which prompted them to seek medical help. They were right to be concerned. Confusion and sleepiness aren't just signs of aging or stress. They can be signs of a failing liver. Liver failure is a serious health condition with many potential signs. We've walked through these signs together, each a potential red flag that your liver may be crying out for help. The pain and swelling in your abdomen, the yellowing of your skin and eyes known as jaundice, and the unexplained loss of appetite and subsequent weight loss. The overwhelming sense of fatigue and weakness that seems to seep into your bones, the nausea and vomiting that become an unwelcome part of your day, and the persistent itchiness of your skin that no amount of scratching can relieve. Then there's the darkening of your urine, a subtle but alarming change, the unusual paleness of your stool, a sign often overlooked, the ease at which you bleed and bruise, a silent plea from your body, and finally the confusion and sleepiness, a fog that clouds your mind and saps your energy. Each of these signs on their own may seem insignificant, a bad day, a poor night's sleep, a reaction to something you ate, but combined, they paint a picture of a liver in distress. So, what can you do? It's simple. Prioritize your liver health, seek regular checkups. If you've noticed any of these signs, don't brush them off as mere coincidences or minor ailments. They could be your body's way of letting you know that something is wrong. It's important to remember that early detection is key to successful treatment. The sooner you catch liver disease, the better chance you have of halting its progression and beginning the healing process. Preventing liver damage is crucial and can be achieved through a few simple lifestyle changes. Firstly, maintaining a healthy weight and diet is essential. Consuming a balanced diet rich in fruits, vegetables, lean proteins, and whole grains helps keep your liver healthy. Secondly, regular exercise is key. Physical activity helps burn triglycerides for fuel and can also reduce liver fat. Thirdly, limit your alcohol consumption. Excessive alcohol can lead to a variety of liver disorders, including cirrhosis. Next, avoid risky behavior such as drug use or unprotected sex, both of which can lead to viral hepatitis, a major cause of liver damage. Lastly, get vaccinated against hepatitis. The vaccines for hepatitis A and B are safe and effective and can protect you from these liver-damaging viruses. Remember, prevention is always better than cure. Take care of your liver, and it will take care of you. It's never too late to start making healthier choices, so start today. Make sure to subscribe to this channel for more health tips. Comment, like, and share our video. Until next time, have a good one.